Hello, everyone. Welcome to Zoom into Wellness. My name is Carolyn. I will be moderating the chat for your questions. Um, and then we have our two panelists, Dr. Young and Anne. Do you want to introduce yourselves?
Sure. Hello,
Dr. Young.
everybody. So I'm Clipper Young. By training, I'm a clinical pharmacist, and also I work at Touro as a faculty member. And I'm a member of the diabetes team.
Hello, everyone. My name is Ann Lee. I'm a dietitian. I'm also on the diabetes team at Touro University, California. We have a very exciting program for you tonight, and let's zoom into wellness. All right, so just for a little bit of heads up of what we'll be talking about today, the topic for tonight is managing high cholesterol. So we would spend a little bit of time to talk about just introducing cholesterol. What are some of the things that we can do and why we care? So let's start with just thinking about the word cholesterol. What would be a typical, what would be something that's typical that you can think of when you just hear the word cholesterol? And this is open to, everyone, all the panelists, and moderators.
Fat.
Fat. Yeah. Anything else?
Unhealthy.
Okay, unhealthy, yeah.
French fries.
French fries, heart disease, I see. For typing in and fat. All right, very good.
Someone in the chat also said heart disease.
Heart disease, yeah, excellent. So sometimes we think about food, right? When we hear the word cholesterol, it's like some of the fatty foods that you've talked about, like hamburgers, French fries, eggs, ribs, steak, bacon, butter, like some of the foods that we think about. And we sometimes think of it as bad, like, cholesterol is something that's bad. But today we do want to tell you that cholesterol is really not bad. Our bodies need cholesterol. Cholesterol is a waxy substance, and it is needed to build cells and other hormones. So our liver makes cholesterol. It is so important to our bodies that it actually makes all the cholesterol that your body needs. And so it's not really a bad thing, but we do get that bad impression. It's because when there is too much of the bad kind of cholesterol in our blood, it can cause problems. So cholesterol may slowly build up in the inner walls of the arteries, making them less flexible and more narrowed. And this process is called atherosclerosis. And it is possible that a complete blockage can happen, and that can cause a heart attack or a stroke. So what does it really mean? When you heard of the term, know your numbers, right? So when we talk about cholesterol, some people also think about numbers and what they get in a lab test. It is confusing when you're looking at a lab test. So why do we even do these lab tests? It's because when you have buildup of cholesterol in your arteries, you cannot really feel it. It doesn't give you any symptoms. It doesn't give you any warning signs unless it is starting to block your arteries. So one excellent way to know early if there is a problem is by knowing your numbers. And so in this case, we're talking about the cholesterol numbers you get back from your doctor when you get a blood test. There are many factors that can affect your risk of getting a blockage. So learning about your numbers and talking with your doctor about your risk is a great start to avoid any future problems. So when you get your lab report back, everybody's lab test result looks different. So some people call it a blood test result report. Some people call it a lab report. And sometimes the cholesterol numbers are listed under something that's called a lipid panel or a lipid profile. And what the word lipid means fat. And so all the cholesterol numbers might be listed under that section. Now, when you get your test back, there might be a lot of numbers, and it can be mixed in with, all different numbers. It can be very confusing to look at, but really, we're just talking about focusing on the basics. So there are 4 numbers that you can focus on when you look at a lab test. So these are the 4 numbers that are more important, and they're really good markers for you to kind of learn about how your cholesterol level is in your blood vessels. So the total cholesterol is served as a reference number. So it's all the different cholesterols kind of added together. So the HDL cholesterol and the LDL cholesterol, the triglycerides, it's a type of fat that kind of floats around in our blood. And part of it is the cholesterol, and that's why it gets added together as well to give you that total cholesterol number. So we've already talked a little bit about triglycerides, most common type of fat that's in your body. Now, HDL cholesterol has a nickname, and it can be called good cholesterol. And it's like a little truck that takes your cholesterol from your arteries and back to the liver. Okay. Now, LDL cholesterol has a nickname as well. Sometimes people call them the bad cholesterol. It's because this LDL cholesterol goes around in your bloodstream and deposits these cholesterol in your artery walls. So when people are looking, or when your doctors or healthcare providers are looking at these numbers, they're looking at the ratio of each one compared to the total cholesterol. Do you have good enough, good cholesterol, high enough good cholesterol, or is your LDL cholesterol low enough to kind of make that comparison to know how your cholesterol profile is, or your lipid profile is. So what can we do? What can we do with these numbers? What do we do if these numbers are off, or if the ratio is off? What if these numbers are telling you that your risk of heart disease or stroke is high? So there are a few things that are known to affect the cholesterol levels, right? Your family history, your age, your weight. If you're overweight or obese, you're at a higher risk of getting higher cholesterol numbers and higher risk of heart disease. Your eating habits can change, your activity level, and if you use any tobacco products. Now, that sounds like a lot of things, but family history and age, sorry, I don't have a magic wand. I can't change that for you. So we don't need to focus too much on that. Just need to know that, whether or not you're at high risk with your age or your family history. But the other things you can actively make a change to make your risk lower. So we're going to take a look at that, and we're not going to spend any time on tobacco, not too much time on tobacco use, because we all know that using tobacco products can strongly increase your risk. So cut down or quit as soon as possible. That can lower your risk of heart disease immediately. So if you are smoking, cut that down. That can definitely help. And so let's start with the food. We can talk a little bit more about food, things that can affect our eating habits. There are too many to list here because everybody eats, but it is not easy to make a change. It's very complicated to also do research on people's eating habits, because seriously, you will never find another person in the world who eats the exact same foods and the exact same amounts as you, even if you live together in the same house. So, so tonight, I just want to share with you on some generalization on food recommendations to help keep the cholesterol level balanced and to help keep the heart disease risk lower. So, you know, with these pictures, you're seeing, you know, if you live in a high-rise building versus if you live in a neighborhood with single homes, or where you shop for your food, how your family upbringing is, it can very much affect your eating habits, and also your religious practices. That can also affect your eating habits. So there are many, many factors that can change a person's eating habits. And so when, I guess my phone is talking to me, I apologize. And so it is talking about, you know, if we're looking at different foods, one thing that can help a person start to make changes on their eating habits to lower their cholesterol levels is to know about the different types of fats. Now, there's the saturated fats, the trans fats, and the unsaturated fats. If you look at these pictures, let's start on the right and top. And so we have like the ribs, the steak, the butter. Those are foods that are known that are high in saturated fats. Saturated fats are typically solid in room temperature, and they are known to cause a rise in the bad cholesterol, the LDL cholesterol numbers. And so is the trans fats, and trans fats are mostly in processed foods like, you know, cookies you get in a package, or fried foods, especially the ones from the store or from a restaurant. They also raise your bad cholesterol numbers. Now, unsaturated fats are liquid in room temperature. And so some of the examples of foods that are higher in unsaturated fats are the nuts and seeds, the avocados, or fish, you know, that's higher in unsaturated fats, or the oils that you may use, those are higher in unsaturated fats. Now you may ask, well, but avocados, fish, they're not liquid in room temperature. Like, what are you talking about? That's like, how can I tell what is saturated fats or unsaturated fats when I just look at a food? It is very, very confusing. And so most people are not clear on which fat is in what food. It's because a lot of the foods actually have a combination. So most of the foods would have a higher percentage of, let's say, saturated fats and lower percentage of unsaturated fats. Or things like avocado, it's got a lot of other things in it. It's got a lot of fiber, and so it may look like a solid when it is in room temperature. So tonight, really, you know, if you are not clear on what foods have what fats, don't worry about it, because I'm going to teach you some ways that you can do that is easy, and you can just start right away to bring that cholesterol down if your cholesterol is high. So it's just 4 simple ways. So if you don't remember anything else, remember these 4 simple ways. Well, and you know, the rest of the presentation, of course, you have to listen to Dr. Young. But you know, just remember these 4 ways of what you can do with food that can bring down your cholesterol level. So number 1 is to stock up on the plant foods. Start planning your meals a little bit differently. A lot of times when, you know, the picture on the left is showing you a typical meal with typical American diet, right? Like you look at the meat, it takes up the most room on your plate, and you have the side dishes to go with it. So in this case, it looks like some cheesy potatoes and maybe, is that a cauliflower or something like that? And so you have the meat, and some small side dishes that's on the plate. Now, if we start thinking about planning our meals just a little bit differently by planning your plant product first. So it can even be broccoli, that would be your base, or a salad, like the picture on the right. If you have a salad, well, what can I add to it to add some protein? What are my side dishes? So if you're looking at this picture, maybe the lettuce would be the base. And then the side dishes or side things that can add to it, looks like there are pieces of strawberry, and there's some cashews, and a little bit of salad dressing. So it's to plan your meal a little bit differently, thinking about it a little bit differently. Your entree is now the plant foods that's in your meal. So that should take up the most room. So that's number one thing, stock up on your plant foods. And some of these plant proteins like dried beans and peas, nuts, seeds, tofu, those are good additions to your meal. And also with meals like this, it gives you a lot of fiber. Fiber definitely helps to bring down your cholesterol numbers. So load up on them as much as you can. If you are starting to change your way of planning the meals and have more plant products in your meals, you will get more fiber. So, as long as you are thinking on planning your meals a little bit differently, you'll get enough and you get more than what you were getting before. So if you are planning to make a change to include more plant products, just make sure you drink more water as you increase on the amount of fiber that you have. All right. And, fiber is also, besides being in fruits and vegetables, it's also in whole grains, nuts, seeds, dried beans, and peas as well. So you can definitely get it from a variety of sources. Meals would never be boring, even without the meat, or at least less meat to kind of dress up your plant-based meal. Number two, kind of watch what you use as your cooking method. So if you use steaming, sauteing with oil and not butter, boiling or grilling, those are nice cooking methods, and they're easy, they're simple. If you like to flavor your meals, just use a lot of spices to flavor your food instead of using cheese, butter, cream sauces, or salt. Those things can, especially the cheese, butter, and cream sauces, can definitely raise your cholesterol numbers and not helping you, even though you might be eating a lot of vegetables, but adding those things in can kind of defeat the purpose of changing to a plant-based diet, because it still will increase your cholesterol numbers. Number three, avoiding the high sugar foods or drinks and alcohol. High sugar consumption and alcohol can definitely raise your triglycerides level. And as I said earlier, a small part of triglycerides is actually cholesterol. So if you are raising your triglycerides levels, you are going to raise your cholesterol levels. So avoiding the high sugar foods, drinks, and alcohol. The last one, number four, avoid packaged foods whenever you can. Try to stay with the whole foods, especially the packaged foods that are packaged in facilities where they make a lot, like those packaged cookies or chips and crackers. They don't always use the best kind of fats when they make those. And so a lot of times they use the partially hydrogenated oils or use palm oils that definitely has more trans fats and saturated fats in it. So if you just, kind of keep a simple rule of avoiding packaged foods whenever you can, you will lower your intake of those and it will help bring your cholesterol numbers down. Now we talk a lot about, bringing the cholesterol numbers down. How do you raise your HDL cholesterol number? That's the good cholesterol that we want more of. So if you want to raise that number up, if that number is not high enough for you, then staying active, just move your muscles when you can. It really helps to keep that HDL number up or raise it up. So staying active for at least 150 minutes a week would help you lower the bad cholesterol, raise the good cholesterol, and it also helps you keep that blood sugar and blood pressure down. All right. And I just have a little side note here is if you're not very active right now, if you're not getting your 150 minutes in a week, don't worry, just start small. Even if it is just a few minutes, but keep it consistent to do it every day. It will build into a good habit and you can, slowly lengthen it. And if you do not feel comfortable and not sure, how much you should start, just talk with your healthcare provider. They will help you figure out, where it might be a good start. Okay. All right, next we have Dr. Young.
Right, thanks, Anne. So Anne touched on two of the few ways in which that cholesterols or lipids in the blood can be managed. So I will do the best I can not to lecture because this is not a lecture, and Anne did a great job not lecturing. So I will follow Anne's lead not to lecture. So the slides here is more of, I want to point out a few things and then we'll get to the discussion, then we can discuss more. So on this slide, I listed all the options when it comes to, okay, medication is needed for cholesterol management. And I remember when I was a student 10 years ago that there are not that many options. It's the famous class, right, statin. And then there's a lot of reputations out there about statin, which I will get into the myth about statin. And then I hear that all the time in clinic that, oh, don't do statin. It's bad, it's bad. Well, because there's a lot of, I guess, misunderstanding, and also the data is not that clean out there. And that's why that there's that bad reputation. And in addition to statin, and we have niacin and also fibrates, Sadia or acetamide. And then those are the older agents that have been used for a long time. And then you have the newer agent that listed there, the injectable PCSK9 injectable, which could be a like once weekly or once monthly. And then the newer ones there that just came out not too long ago, and probably you will never see it. It's just because some of them are approved for very specific use, and also because of insurance problem that we don't see it out there used that much. So still, even though that we have more and more agents being developed out there for lipid or cholesterol management, but you will still see statin as the workhorse when it comes to cholesterol or lipid management. So let's get more into it. Next slide, please, Anne. So here, and once that and there's a lot of options when it comes to statin, right? You might have seen all the names on there, but the point of this is I want to highlight even statin, there are a lot of different potencies, or what it means is the strength is different. So usually what you would see out there, the options, there are three that are most commonly prescribed out there. So you will see on the left-hand side of the slide. So you see atorvastatin. So the brand name is Lipitor, and also rosuvastatin is now generic. The brand name is Crestor, and also simvastatin. And those are the three common ones. So in my opinion, nobody should be on statin for two reasons. First, there's a lot of drug-drug interaction with simvastatin. So when it comes to the safety standpoint, simvastatin is not the safest to use. So versus atorvastatin, it's a lot fewer drug-drug interaction. So that's why that when we start statin, most likely now atorvastatin is the drug of choice. And also the second reason simvastatin is not the good choice is it's not that strong. Because when you look at here, when you do a lipid management, we want to start a dose or strength of the medication that will lower your percentage of LDLs, because LDL, the bad cholesterol that Anne talked about earlier, that we want to lower to the goal so that we don't need to worry about it in the beginning. And then of course, then we will recheck your lipid in 6 months or in a year and see if the dose is adequate or not. So that's the reason why that from the starting of a statin to the next time that we checked in, probably we'll wait 6 months or even a year to check in on the effective of the medication. And that is the reason why that we want to pick the medication at the right dose, then hopefully that will drop enough. So, and then that means you want the strong one, right? As strong as possible. So that's the reason why that mostly that you will see is atorvastatin and also rosuvastatin out there. And also there's a different intensity. What it means is just the strength or the LDL reduction when you pick the agent, okay? So I will talk more about that in a bit. So next slide, please. So myth. So this is all what we want to talk about today. Actually, this is something that I really want to talk about with the group today. So this is just 3 of the myths out there that I was able to find about statin. I'm sure there's a lot more out there. So if you hear more out there about statin, please type it in so we can discuss about it. So first thing is taking statin drugs would lead to diabetes out of the blue. So I think what they're trying to say is by taking statin, my sugar will increase to a point that to a diabetes level. So the data out there, there are studies out there, but however, one thing that don't miss is the population in which that the study was conducted. The study was conducted in those who already have prediabetes. Then of course, that would be the natural progression, right? Even without statin, the sugar will continue to rise if there's no intervention made. So because of that, and then because of the data or the result released, and then people just took it as, oh, statin will increase the sugar, and then that to a high level, high enough that would lead to diabetes. So again, so that would be the population that they study on. But for those whose sugar level was normal, this finding was not true. Okay. And secondly, so the second myth was about statin frequently cause memory loss. So, and one thing that I would like to point out is it's true that FDA actually added this line on the drug label saying that potentially statin could lead to memory loss. However, the basis of that addition of that line was based on some very muddy or low quality data, or the data from low quality study. So even though they added, but then later on, because of this, they added, and later on they conducted more study and to find out, is this true? So from the higher quality study, that this was not the finding. So, and the high quality means that randomized controlled trial. What it means is the bigger trial to find out, to test how true this claim was. And also, if anything, then statin has been approved to reduce the risk of heart attack and stroke. So in anything, actually, statin will protect your brain, or protects whose brain who have a high cholesterol, because help to reduce the cholesterol, and in a sense that will to reduce the risk of having stroke or heart attack. Okay, and the last thing, so you could get cataracts from taking statins. So the truth is, again, so there's study out there saying that. However, one thing that we need to keep in mind, the studies were actually conducted in animals. So that's number one. And also the study design was not that strong, meaning that again, it's not strong data. So and then FDA or other people or the researchers, they did more studies with higher quality study design, and then in humans, and they found that that's actually not true. So statins would not cause the formation of cataracts. But if you are concerned, so what the recommendation out there would be, if you're on statin and you're concerned about getting cataracts, get your eye exam. So I think that would be one thing that you can prevent, or you can, if that develops, then this condition can be caught early, and then intervention can be added to the medications. So, but in the nutshell, all the things that are listed here, it's not true at the end, but then there are some muddy studies out there that send a message that, oh, statin could cause all of that. But what is true that I can share with you is statin has been proven to reduce the risk of heart attack and stroke, especially for those who have type 2 diabetes. And that's what I will get into in a bit. So Anne, next slide, please. No, not yet. Okay, this. So I mentioned about different options for cholesterol management. So, and then the question is, okay, well, there's a lot of names, as Mario mentioned. So what is what, and what treats what? So one thing that let's focus on statin first. So Anne talked about the HDL and LDL and also triglyceride a little bit. So those are the three things that we oftentimes focus on when we are talking about cholesterol management. So for statin, remember, that will help the consumer reduce a bad cholesterol, LDL, and also that will help increase HDL. And also, depending on the triglyceride, which is the fat in the lipid, and it might help the management, but the level varies depending on how high or how low. And the other things, so I will not get into detail. So, and also I listed the 4 other classes. And then, for example, one thing that I would like to point out would be fibrates, the bottom. So if someone wants to treat triglyceride, because triglyceride is 400, 500, and treatment is indicated, then fibrate would be the medication to be used or initiated. Or on the other hand, if someone wants to increase HDL in addition to the food or the exercise, and then fibrate would be another medication to choose for increasing HDL. Okay, so next slide, please. So here would be medications. Any medications that we have out there, there's always side effects. But a few things I would like to point out here. So you see diuretics and beta blockers. So those are really commonly used hypertension or high blood pressure medications, especially diuretics. So, and also beta blocker for those who have heart condition. So even though the studies have found that, oh yeah, being on these 2 classes of medications, their LDL might increase, but in real world practice, we don't see it that often. So I would say don't worry too much that if you're on a beta blocker, or if you're on a diuretics, for example, hydrochlorothiazide, don't worry too much about that will increase your LDL to a high level. However, on the other hand, the other 2 that I would like to point out here is if you're on a prednisone or steroid, or so for a long time, and that is something that you need to worry about because it can increase your cholesterol. And also protease inhibitor. So that is one of the classes for HIV. And also there are some antipsychotics. So that can cause LDL increase. So in the nutshell, most medications out there, we don't really need to worry about worsening your lipid levels. But if you do come across something that's listed on the list, so do ask your provider. And the one thing that you can do is before you start on medications, get your lipid panel, and then a few months later of starting the medication, get it again, then you can see that how much the impact would be. Because you don't want to use another medication to treat the side effect of this medication. So, and this is something that you need to work out with the prescriber, okay? So next slide, please. So now let's talk about why do we care? Well, because uncontrolled cholesterol can lead to many problems. But a few things I want to highlight is, before I do that, so this is a slide really showing you what happens in your blood vessel when you have high cholesterol. So let's start from the left. So when you have low, that means this is a tube, right? So you're seeing the cross-sectional view. So this is a tube. So when you have low cholesterol, that means the blockage is not there. So that the term that Anne used earlier was atherosclerosis. So that would be the blockage is not there. So you see the blood can still go through pretty freely, and then you will not develop the complication down the road. And so pay attention to the colors. So the blue would be the good cholesterol, HDL, and the yellowish orange, that would be the bad cholesterol, LDL. So as your LDL levels increases, you also see a decline in the HDL. So that they go hand in hand. So because of that, we need to always look out for both, not just one. So you always want your HDL to be high, your LDL to be low. But the nature is actually the opposite. When you have like from your low to the normal, so now you have a little bit more. So that is where you want it to be. So the LDL, and also cholesterol is not in as a class, cholesterol is not a bad thing. Everybody needs cholesterol to be functional, to stay alive. But the level in which the cholesterol that we need to have has to be within that range. So now from normal to a high, so yes, you can see on the high end side. So the lumen or the cross-sectional is blocked, right, by all those bad cholesterol. And this is what you don't want your blood vessel to be, because that will later on lead to heart attack and stroke, which is the next slide that I want to get to. It's the problems when we don't solve it. So on this slide, I specifically highlighted in the brain. So in the brain, stroke would be if the blood vessel is blocked, and then the risk would be having a stroke. So the blockage, so the brain blockage, and then it will lead to stroke. And then from stroke, that will lead to memory loss. So that would be the three things that I have the picture highlighted in the brain. So, and the next slide will focus on your heart. So the heart attack, why do people have heart attack? So one of the many reasons would be the blood vessels around the heart is blocked. So that's the reason why that people would do surgery to open up the lumen or the opening, so that the blood can go through the blood vessel pretty easily, so that it won't develop. Because whenever the heart, the blood vessel around the heart is blocked, that means the blood is not getting to the muscle. So if the blood does not get to the muscle, that means the muscle will start dying, and then that would lead to heart attack. So that's so important that we need to keep the lumen open to avoid this problem. And also, lastly, at the bottom, I also highlighted gallstones. So if someone's lipid level is really high, not only that will impact the heart and also the brain, and gallstone can form in gallbladder. And that's why that you've heard people will have to remove the gallbladder. One of the reasons could be that there's a lot of deposit in the gallbladder, which that leads to gallstones. Okay, so next slide. So at the bottom, the lower extremity. So it could, if the cholesterol level is high enough, and it could lead to numbness of the legs. So I also in clinic, I see patients with diabetes, and some of them, they would just complain, saying that, well, I have this numbness. So it could be really due to uncontrolled diabetes, which then damage the nerves, but it could be that the cholesterol is so high that will cause the numbness. So my point is, numbness could be caused by multiple factors. And then the next thing that I would like to point out with the next slide, please. And so what can we do? Oh, well, not yet. So the linkage between high cholesterol and type 2 diabetes. So one thing I would like to point out is at the bottom right there. So dyslipidemia. What is this dyslipidemia? So this is a fancy term. It's a very specific pattern of your cholesterol level. So if you have a increased level of LDL, a decreased level of HDL, and also increased level of triglyceride, and that would be diagnosed as dyslipidemia. And there's a linkage between type 2 diabetes and dyslipidemia. And that's the reason why, for those who have type 2 diabetes, after we initiate the appropriate treatment for type 2 diabetes, we also want to start statin. Just because for those who have type 2 diabetes, this is something that we need to look into, like ABC. So when we do type 2 diabetes management, we have to do A, B, and C. So A would be A1C, the sugar, B would be blood pressure, and C would be cholesterol. So that's the reason why that having type 2 diabetes is more than just sugar management. Okay, so next slide, please. So here is just telling you that for those who have a lot of fat tissue, that would lead to insulin resistance, right? So this is the underlying problem for type 2 diabetes. And then you have a high level of fat in your blood. So with a high level of fat in the blood, that will tell the liver to produce sugar, right? The sugar. So a part of liver's job is to store sugar. So if too much fat in the blood, and that will translate to sugar being released from the liver, and that will lead to type 2 diabetes. Okay, so that would be the linkage. So next slide. So here, so I mentioned about the linkage now. So what can we do? So what can we do to help manage not just type 2 diabetes, but also the high fat, so triglyceride? So one thing is, I guarantee you, I've seen it in clinic, that for sugar management, it's not just for sugar management. Once the sugar is controlled, we often see that the triglyceride level is also controlled. It's just because what I mentioned earlier, that you don't have as high level of fatty acid or a triglyceride in your blood. That means it won't trigger your liver to produce sugar. And that is the reason why that once your sugar is controlled, and your triglycerides is also controlled. And there's a side note that there's one medication that is listed on the slide called ADCES, that's a brand name, or pioglitazone. Then that is commonly used for well, not as common now. It's just because we have a lot more options for type 2 diabetes, but it used to be the medication that we use a lot for sugar management. But in addition to sugar management, this medication is very good for controlling triglyceride, reducing LDL, and also increasing HDL. So for those, we use that in clinic. When we see their lipid panel is really high, the numbers that Anne talked about earlier, then we will put someone on this medication for two reasons: targeting lipid and also targeting sugar. Okay, next. Okay, so in the nutshell, so this is a summary slide. So well, first is, for those who have type 2 diabetes, we want to reduce the risk of having heart attack and stroke. And the way that we want to do it is to use statin as a medication to do it. And then for statin, so, and I mentioned earlier, statin continues to be the workhorse for lipid management. And then lastly, people with diabetes and also heart condition, so they would respond to statin the same way as for those without diabetes. So that means statin would work in those who with diabetes and without diabetes. Okay, so I think that's the last slide. Yep, so now we are open up to questions. So, and I saw a few questions. Why don't we do one at a time?
Yeah, there was one question in the chat. It asks, how can we separate the good from the bad, and how do we know how do we know by eating what is good or bad cholesterol?
So for cholesterol in the food, there is not good or bad cholesterol. It's just cholesterol in the food. It's after it gets in your body, you know, what it does. That we call them HDL and the LDL. And so the cholesterol amounts are usually higher in the red meats or processed meats. And so if you are looking to lower the cholesterol amount, so it's to eat less of the animal products. None of the plant products would have cholesterol in it. So sometimes, you know, you might see a peanut butter jar that says no cholesterol, you know, kind of big letters on the jar. It never has cholesterol anyway. And so, because, you know, it is a plant product. So, you know, if you're trying to determine, whether or not the food has a high cholesterol content or not. It's just by looking at where it comes from. If it comes from an animal, it will have cholesterol. If it comes from a plant product, it will not have cholesterol in it. I hope that answers the question.
I add something to the good and the bad. Like, why do we call HDL is good and LDL is bad? Well, so think of it this way. HDL, it works by bringing the fat from your liver to the extremities. So it actually helps to lower your fat level. So in a sense, and that would be a good, the higher the concentration of HDL that you have, that means you can bring the fat from the liver to the other parts of the body. It gets used. So HDL would be the bad because it gets stuck on the walls of the blood vessel, and then that would be the start accumulating the block, right? So that would be the bad cholesterol. So yeah, that's that. I think that's as far as we want to get to it. So I just want to distinguish the difference between the good and the bad, and then the names would be HDL and LDL. So here, besides prescribed statin and other cholesterol medication, what over-the-counter natural supplements like omega-3? Yes. So omega-3 fatty acids. So one thing I would like to clarify though. So omega-3s, oftentimes we use it not for cholesterol, it's for lipids, triglyceride lowering. So some patients that they don't want to, or they're allergic to, or they just don't want the side effects from niacin or some fibrate, then that would be the option that we use for omega-3, so fish oil. Or there are other fatty acids out there that has been developed for triglyceride lowering. So Lovasa, probably you've heard of that. There's a brand name, or Vasapa. So those are newer agents, and they're not fish oil, but then they can be used for triglyceride management. I'm glad that actually, Mario, you brought up the supplement. So I would say be really, really careful when we are buying supplements, because they make claims that might not be tested. So because we see it out there. So that's the reason why that whenever we see patients bring in bottles of supplements, and then they make claims on the bottle, but then it's never approved by the FDA. But if so, that's the case, that we normally don't really, how should I say it, would push for supplement. And also from a consumer's perspective is be really careful when we are buying products off of the over-the-counter product, because they will say that it was natural, and it doesn't mean that there's no drug-drug interactions with the medications that we're taking, right? So, and also there's an example would be like warfarin. And then someone is on warfarin, and then they would buy over-the-counter like St. John's wort for depression symptoms. And then those two can thin the blood. And then we see it often that they were taking two together, and then voila, and then that will lead to a major bleed. So that's the reason why. Like St. John's wort, it's a supplement, but doesn't mean that would be safe to use. So it's all, though, that's just one thing that I would like to point out. Whenever we use supplement, always check with a healthcare professional. And they might not have the answer, because nobody is trained on supplement. So we have to look into like, okay, what is your condition? And then is it safe to use? Okay.
All right, I think it is time, and I do appreciate people being here and supporting the Zoom into Wellness. And, thank you so much for being here tonight. We really enjoy your company.
Yeah, thank you.
Have a good night.